Good morning, Sister Aisha. Sister Aisha, you can start.
Assalamu alaikum. Can you all hear me?
Walaikum salam. Yes, I hear you.
Okay. Okay, the slides are visible?
Yes. Just bigger this slide. Press under Sister Aisha.
Yeah.
Okay, thank you.
Okay, hello, Assalamu alaikum everyone. I will be presenting the talk, the Continual Professional Development on Guide to Successful Breastfeeding for both educators as well as mothers. I am a certified breastfeeding counselor and also a trainee in Amani childbirth education, also training in infant gut microbiome. Okay, the first step to successful breastfeeding begins before the birth of your baby. It's by choosing the right care provider. You will need to shop around in choosing the right care provider even before you plan your conception, or if you are currently pregnant. It's better that you choose the right care provider in the beginning of your pregnancy itself so that you can save time and effort in learning for the prenatal classes and also knowing about what to expect during the pregnancy and during your breastfeeding. It's important that you attend the prenatal classes as well because this helps you getting educated regarding your pregnancy issues, what to expect during different trimesters in pregnancy, and then how your pregnancy and your delivery will impact your breastfeeding after your delivery. What are the challenges that you might come across? What are the things that you might face difficulty in? And understanding also the newborn behavior, which is very important in your step towards successful breastfeeding. You need to ask the right questions to your doctor because you have the right to know what certain medications or certain procedures have an effect on your body and on your breastfeeding as well. If you know about these things and you know that the doctor is supportive regarding your birth plan and also your post delivery plans, and if you have a doctor who is really supportive, it will empower you to have a better bond with your child and also a better breastfeeding journey with your child even during the initial months, when that is the time, if you are a new mother, you would face new challenges which you haven't come across before. Even if you have known women around you, you might not know how to handle on your own when you face a challenge. So when you know what to expect from your doctor, from your pregnancy and your post-delivery time, you will be able to better handle your situation and your challenges with an informed decision. Know your patient rights and talk to the doctor with full confidence and ask a doctor the right questions so that you know what are your rights and what the doctor supports you in. And it's also important that you learn about breastfeeding before you give birth. Many women, we are not able to know what the breastfeeding holds, and we take it for granted that breastfeeding is something very easy or it's something that very difficult. So we just rely on our peers, might not have the knowledge, and we might also make wrong decisions, wrong steps, and then end up giving the baby just the final solution as a formula. So if the final solution is a formula just by default and the majority, you won't know how to nurture your baby in the right manner. Breastfeeding is the natural nurturing step towards a healthier motherhood and also a healthy childhood. So it's important that you learn about breastfeeding before you give birth. And as we are here always to be with you and help you as a peer breastfeeding counselor and also as lactation consultants, which I will come to in my future slides, explaining you what we actually do and how you can help yourself and your baby get a very healthy start to your breastfeeding journey, inshallah. The next is knowing what to expect soon after birth, as how I introduced in my previous slide before. Birth is not easy. Birth is not difficult if you are empowered to do it with the full information and make an informed decision with the knowledge that you get from experts and educators. So, knowing about birth interventions and how it affects breastfeeding plays a very crucial and important role in determining your breastfeeding journey, how well and how far it goes, how far you can put an effort in creating that special, nurturing, natural bond with your baby. Any kind of birth interventions which are medically necessary, you will need to know what impact can it have on your birth and as well as post-birth, because any kind of intervention, whether it's induction, whether it's antibiotics given, whether it's an IV or a glucose given to you during your delivery time or your labor time, it does impact breastfeeding in certain manner. So if you are informed about those things before you give birth, when you're discussing with your doctor or when your doctor wants to have an intervention, find out the reason why she wants to do it. If it is medically necessary, then find out what effect can it have to the baby and also on you, so that you can be well prepared to handle your breastfeeding journey in the most right manner, in the most correct manner, so that you're dealing with those challenges by discussing with your peer counselor or discussing with your lactation consultants to overcome that challenge. The initial challenge itself is the hardest to overcome, but the most important and the most effective. Because if you make a delay in overcoming that initial period of challenge in your breastfeeding time, it can impact your breastfeeding in the long term. And you might have to make more efforts to come back to breastfeeding if you have started formula for some reason, or if you have made the wrong decision before your delivery, it will impact you more and make it more difficult for you to go back to breastfeeding in that time. And you don't need to panic. And always, as new mothers, often feel scared that it's just one or two drops of that yellow milk or one or two drops that just come and may not help the baby at all after delivery. You don't need to panic. It's just colostrum. The colostrum is a golden liquid that is the beginning of before the mother gets the mature milk. Colostrum is the support for the life system for the baby when it's born, and those are the first drops of golden liquid that the baby gets, which is enough for the baby's stomach, because the baby's stomach is really very small, like a size of a pea when the baby is born. So even when you get information that it's just drops of milk, you don't have a milk supply, and you need to give the baby formula, you just don't need to blindly go with that mindset, because this golden milk colostrum, even those one or two drops, is enough for the baby to get that the most important nutrition that is very, very, very important when the baby comes into this world. And that itself has a lot of benefits to save the baby from future long-term medical issues and thrive in this world in a more natural and a more healthier way. So the fear of low milk supply comes when you are misinformed about your situation and you don't know exactly what to do. If your care provider is not particularly informed about this correct way of nurturing your breastfeeding relationship, you might end up giving the baby a formula, which is maybe just having a few drops of nutrition, but it is not the dynamic fluid that the breastfeeding mom gives to the baby throughout her 2 years of life, till the 2 years till the baby weans off, which is the golden standard for any mother and baby who give birth, because the baby's benefit is long term, the gut health for the baby is long term. So the low milk supply, the fear of that low milk supply needs to be correctly diagnosed by discussing with your breastfeeding counselor or the lactation consultant, so that you really know that you have a milk supply, which is very, 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 very rare among mothers who have just given birth, because to establish the milk supply is easier when you know and you are rightly informed about this practice of starting your breast milk journey with your baby and successfully breastfeeding your baby, knowing what to expect after your birth. Okay, so let's come to healing your gut, because the gut itself, every disease forms in the gut. The reason why I'm mentioning healing your gut is because before you plan to conceive and before you even get the fear of getting a low milk supply, because every your lifestyle, your environment, your emotional feelings, your emotional, physical, and your spiritual mindset affects your gut in a very important way. If you alter this gut, you also help yourself in a better breast milk supply and giving your baby a good start to your baby's life. The first step in healing your gut is altering your diet. You should read the labels, avoid processed foods, and you need to stick to particularly good cooked foods, slow cooked foods preferably, and you need to eat all the necessary vegetables, fruits, and proteins that are necessary during your pregnancy, and also alter your diet accordingly when you're breastfeeding. The diet for breastfeeding is not the same as a diet during your pregnancy. So during your breastfeeding journey, by altering your diet that is suitable to your baby and to yourself, knowing the allergens, knowing what prebiotic and probiotic foods that you need to give yourself and the baby helps in also boosting the milk supply to a certain extent. Keep home remedies and natural first aid box handy, which is important. And if you have these natural first aid box, which I call maybe some homeopathic medicines or some natural herbal remedies or Ayurvedic medicines, for before you actually end up going to a doctor and taking these allopathic medicines, in the initial stage itself, once you recognize what your body needs, if you have a little roughness in the throat, you just treat it with honey, warm water, and whatever is suitable. When you consult your functional medicine practitioner or your family medicine specialist, they can advise you on these home kind of remedies where you can prevent instead of actually treat them, which does affect your breastfeeding in certain way when you take certain herbal remedies also. And also mainly if you go into over the counter medications, and then you have you end up having antibiotics which can completely destroy the gut lining of the baby and your gut lining as well, where you need to heal it back after you have taken the antibiotic. So you need to know about these effects so that you can save yourself from further bigger treatments than having a small home treatment in the beginning initial stages when you start experiencing a symptom. Sleep and self-care is very important for a healthy breastfeeding journey. If you don't get sleep, and it is pretty natural and it is pretty common that mothers lose their sleep in the beginning weeks of their motherhood journey, especially when they're breastfeeding, and they fear that the breastfeeding might not allow them to sleep. So they might resort to formula again, and they feel that formula would be easier in managing the baby. But in fact, if you see, for a breastfeeding mom, if she has learned herself to feed the baby in different positions, even while lying down, she's able to handle and she's also able to get the sleep even if the baby is feeding during the time of feeding. She is feeding the baby on demand. The baby is getting comfort from the mother, and she is also getting that peace and that rest while sleeping and by in the lying down position while feeding the baby. Her self-care is where she takes care of her body. She has good baths, she has a good diet, a good food, and a supportive family around her so that she can take care of the baby and get bonding with the baby in the initial stages of her life, of the baby's life. At least one aspect of self-care she should be able to make each and every day so that she's able to get that motivation and that boost of energy to look after the baby the whole day. And I do understand that new mothers, especially in the beginning, they would feel overwhelmed and they might go into postpartum depression, which is very common. And that is another area that can also impact the breastfeeding journey for the baby and for the mother. So this kind of self-care, whether it's her own, whether it's the family around her, whether it's sleep also, to some extent helps the mother breastfeed the baby in a better possible way and improve her outcomes, improve her breastfeeding outcomes for herself, for her health, and for her baby. Avoiding processed foods is a very big factor in not creating a bad gut system for the baby and for the mother, because any processed foods that the mom or the baby has, it affects the gut lining again, and then that impacts the correct functioning of the microbial seeds for the baby to get a good microbial system, a good microbial gut filled system for the baby, in order that the immunity for the baby increases. Any processed foods is better to be avoided to a very large extent, because anything processed can impact your immunity as also your baby's immunity, because everything the mom eats, it's passed to the breast milk to the baby, and it impacts the baby's gut microbiome. So making an informed decision before, during, and after birth has a very big impact on the baby's and the mother's health. One thing I would like to stress is the prebiotics and the probiotics. The prebiotics help in creating a good lining for the gut system. Prebiotics, something as garlic, these kind of vegetables, nuts, seeds, they have a very good effect on the gut of the mom also. And if it is suiting the baby, then the baby is also getting benefit from the prebiotics. And probiotics, something like fermented foods, yogurts, kefir, kombucha, these are probiotics which help in healing the gut. So you need to maintain the gut and you also need to heal the gut. To maintain the gut, you need to have the preventive measures through the prebiotics, which will keep the lining of the gut and keep the gut healthy in order that good microbes survive and help increase the immunity for both mom and baby. And the probiotics help in treating also the gut system, where the antibodies that the mom produces during any issues of her health play the correct role in treating the conditions for the mom and for the baby. Probiotics are very important, yogurt is very important, but there again you need to judge where your gut is accepting these issues, because if the mother's gut is not accepting certain prebiotic or probiotic foods, then it is possible that the baby's gut will also have the same impact, because the baby's gut resembles the mother's gut. So whatever the mother is able to digest well, the baby can digest well. There is a possibility based on the research in infant gut microbiome and what the microbial community flourishes in the baby's gut and the mom's gut. So, but whatever diet you have, make sure that you have certain amount of prebiotic and probiotics so that your gut is remaining healthy throughout the breastfeeding journey and even beyond, because this prepares also for a healthier conception in the future and healthier pregnancy. Now, another important thing that I would like to introduce you to is how the vaginal birth helps in seeding the right kind of microbes in the infant gut. Now, there is a colonization of microbes in the infant gut when the baby is born vaginally, and the colonization of the microbes in cesarean is totally different. There is very less colonization of microbes in the baby's gut who is born via cesarean than the baby born vaginally, and it is the baby which is born through a vaginal birth and also a natural birth, preferably without interventions, has a much better and healthier outcome in tolerating more foods and having the wide variety of microbial community to treat future diseases by increasing the immunity of the baby in a better manner. Same thing applies to the mother's gut system, but it's usually that if the mother's gut has been compromised, the baby's gut will also be compromised to a certain extent. But again, having a vaginal birth helps in seeding the right kind of microbes in the infant gut at the right time. When the gut microbes in the baby's gut are seeded at the right time, in the right amount, the baby's gut system develops in a better way to give a better, higher immunity than those babies comparatively who are born by a cesarean or also born through interventions, because they are exposed to different other microbes environmentally. So this is one important factor that I wanted to introduce even to the educators about having the right kind of seeding of the microbes to help the microbes colonize the infant gut system in a much natural and a much healthier way by stressing on the vaginal natural birth. Now let's come to newborn breastfeeding behaviors. Now after the birth of the baby behaves in a certain way, which many moms don't understand. But usually many babies, for the first few months of their lives, they have a set pattern of a newborn breastfeeding behavior. And mostly the newborn breastfeeding behavior can be understood by discussing with your breastfeeding counselor or a lactation consultant if it is necessary for a physical checkup. When you understand the basic feeding cues for the baby, about their getting hungry at what time, the feeding cues such as sucking on their hand, um, their tongue coming in and out, sucking on, I mean, on the lips, the tongue's coming in and out, the initial feeding cue, then the cry, the kind of cries the babies have. It helps the mother address the baby's feeding cues earlier before the baby starts crying and then refusing the breast. Because any late feeding cues, if it is delayed to a very long time, the baby can refuse the breast and it can make the mother agitated and also the baby more agitated. It can delay the breastfeeding process. Babies have a pattern of cluster feeding and comfort feeding, especially during also their growth spurt times. Also, if they are falling ill, they have a pattern of cluster feeding where they keep feeding on the breast for a long number of time. The mom might feel that she's not having enough time to get up or do her own things, and she might feel that maybe it's her low milk supply. Again, here is a misconception that they feel it might be a low milk supply, which is in fact not. The babies in the beginning months of life have a certain pattern of cluster feeding frequently at 2 weeks, at 6 weeks, 8 weeks, 3 months, 6 months, they have. But even in between, they can have a lot of patterns for cluster feeding and for comfort feeding, which is absolutely normal. The mother needs to manage her time and seek help from her family or friends or the community where she can manage this time more peacefully and address the needs of the baby. It's just a few initial weeks that she needs to go through this, and once she understands the pattern of her newborn and her baby, she will be able to address the pattern of the baby's feeding cues in the right manner. Now sleepy baby. This is sleepy baby and jaundice. Jaundice is one condition where many babies get because of their liver functioning, which is not yet established. So it's pretty normal to have jaundice for many babies. And usually the jaundice goes by continuous breastfeeding and more breastfeeding on demand. Within about 10 days to 20 days, the jaundice should be able to go away without much increase. Any kind of breastfeeding is beneficial. And if it is more frequent for a baby with jaundice, it will be able to heal the baby earlier. And usually jaundice babies are sleepy babies, and that is kind of the opposite of cluster feeding and comfort feeding, where they won't latch or they won't feed for a longer time. They will sleep in between the feeds, so they won't be able to get the right amount of breast milk that is needed for them to cure the jaundice. So the mother can help the baby get the milk by expressing the milk directly from the breast into the mouth of the baby and trying to coerce the baby into sucking by taking on the ear, or by little finger on the toes of the baby so that the baby can suck well at that time. Wake the baby up a little bit by pushing on the ear or the toes. It helps the sleepy baby in feeding, or she can express directly. But make sure that the baby is breastfeeding more on demand and also more continuously so that the baby is healed from the jaundice. The baby's sleep patterns keep changing throughout the first few weeks of life. So the sleep patterns can vary from some babies sleep in the morning and wake up at night. Those are the most common sleep patterns. Some babies sleep at night and awake in the mornings, but it's totally normal that the baby is continuously feeding and on and off sleep times. In the initial first few weeks of life, babies sleep up to 22 hours, 20 hours, and then gradually, as they become more active, their sleep patterns show a reduction in their sleep times, and it comes up to 14 to 16 hours. The sleep patterns of the baby vary from the initial alert state to a deep sleep state, where the mother can also address the cues of the baby during that sleep pattern, where she feels that the baby is waking up from sleep, moving her hands or legs a little bit, and making little amount of cooing noises. So that would make the mom understand that the baby needs milk. And in the high alert state, when the baby is interacting and then she sees again there is an agitated movements for the baby's hands and legs, where the baby's expression might change, she might get an idea that the baby needs the feeding at that point. It's important that the mother does not let the baby go to a later feeding cue stage where the baby is starting to cry loudly and hysterically, because it will affect the latch and will affect the feeding of the baby. Now, the correct latch depends on the feeding position. The feeding positions are many: cradle position, the cross cradle position, which um, mothers would be educated on through the breastfeeding counselor and or the lactation consultant if they have issues. Usually these initial problems are solved by the breastfeeding counselor itself, but if she's not able to uh, progress well in her breastfeeding journey in the initial times and it's causing more problems for her, she can anytime visit the lactation consultant to show the breastfeeding how she's doing, and the lactation consultant will help her in dealing with that problem. So the feeding positions, the basic feeding position is a biological nurturing position, which is a laid back position. When you lay back on your pillow in an inclined position about 45 degrees, your baby is on top of you. The baby's tummy is touching your tummy, and the baby is a natural position where it latches onto your breast and uh, starts feeding. It is also an anti-colic position, you can say, because it helps the baby remove those gases and it doesn't allow the development of air bubbles, which is a normal problem in babies with reflux, that they during the other cradle position or the football hole position or different positions, where they end up getting those air bubbles from a little bit of a mismanaged position that ends up in reflux, or it can also end up in colic since they take in a lot of air bubbles. Nipple pain and trauma is again caused because of the feeding position also, and also because of improper sucking pattern for the baby. If the baby is having a tongue tie or a lip tie, it can result in a nipple trauma or nipple pain. If the nipple is flat or inverted, it can again have an issue with the nipple and cause pain or bleeding as well. So it's important that the mother needs to check that her feeding position is correct, or she's having a proper nipple at that time, checking that the nipples are and the areola is properly going into the baby's mouth, and the nipples are not flat or pinched when the baby is removing the mouth after feeding. So these are the points that the mom needs to note down to see why she's having the nipple pain or the nipple trauma. The engorgement and mastitis are very common among new mothers. The reason for engorgement and mastitis again is because either because of sometimes higher milk supply. It's because if the baby is not feeding on time or has increased the length of time before the next feed, there is a possibility that the engorgement happens. Engorgement is something where the breasts feel hard and heavy and warm, and she might sometimes have pain, sometimes doesn't have pain. But if she's having the pain with the engorgement, and if she's feeling feverish or with chills, it is important that she tries to express some amount of milk and also consult the breastfeeding counselor or the lactation consultant to know what measures she needs to take during that time. So the engorgement happens even also because of the nipple pain or trauma, because if there is a trauma to the nipple, then the milk ducts won't be able to give out that milk at that point of time. So if there is a blocked milk duct, it can lead to engorgement and mastitis. It is very important that the mom is taking probiotics also with that to prevent the engorgement and mastitis and any kind of infection. She keeps herself hygienic by having warm baths. That also helps in a certain manner. And cabbage leaves are also a way where she can release the engorgement by applying the cabbage leaves on the affected breast. But it's important that she remains in touch with the breastfeeding counselor or the lactation consultant to give them a, a idea of her progress, whatever is happening, so that it helps her in dealing with this issue before it turns more difficult. Now, how to know the baby is thriving well and is growing well? The main sign for the baby's growth is wet and dirty diapers. In the few days of life, the baby wets 1 to 2, 2 to 3 wet diapers and has one diaper on the first day of life, second diaper, first in the for one diaper maybe in the first week of life, one and it increases as the days pass by. So they can have multiple dirty diapers. So by the third day of life, they'll have 3 dirty diapers. By fourth day, they will have 4 dirty diapers. So the best way to see whether the baby is doing well is having wet and dirty diapers every single day. If 1 or 2 days the dirty diapers are not produced, then it's possible that she might have not fed well, or the mother would have been very stressed or sleepy, because everything has an effect on the milk supply at that point of time. But it's temporary that the letdown would not happen during that point of time. So if she is having a baby log that where she notes down her sleeping pattern, her food, what she has had at that time, and the baby's sleep and feeding and urine and poop patterns, it helps her to analyze her own situation and understand with what has affected the baby's poop diapers or what has affected the baby's wet diapers. Personally, for me, it has helped me a lot because, and with that, I could relate and ask my breastfeeding counselor and my lactation consultant whenever I felt there was an issue with her diapers. And you know a set pattern where your baby is doing well when you see or go through the baby log, each baby log for every week, so that you know that what kind of eating or sleeping or your stressful habits has an impact on the baby's health. Changes in sleep patterns is what I had discussed earlier as well. Like sleeping through the night for the baby is normal if it is happening once in a day. If the baby is sleeping for like 5 hours once in a day, it's fine. But if it is happening repeatedly, then the mother needs to wake up the baby to feed on time and see that her milk supply is maintained during that point of time. Waking up in the middle of the night is very common and it's very natural for the babies. It's also a way that the babies are safe from sudden infant death syndrome, and it helps the mom also keep a check on the baby and feed the baby on time, on demand. Comfort feeding is when the baby does when the babies are sick, or when the babies want to be just close to mom, or when they're having a growth spurt, which is very normal. And it also, comfort feeding or just sucking for comfort, it helps boost the milk supply for the mom. The mom's diet and nutrition plays a very significant role. Eating on time, not to your fill, but eating on time. When you have a very big gap in eating, it's possible that at that point, since you don't have the calories to produce the milk, your milk supply can be affected temporarily at that time. Personally, I have noticed it with myself, is where I have, through the baby log, I have understood whenever I had not eating on time, but eating every 1 or 2 hours will help regulate your body's metabolism. So when your metabolism is regulated, obviously your milk supply is going to be regulated at that point of time. When you have had no sleep or stressed out, or you haven't had the right amount of calories at that day, it can impact your supply at that moment temporarily, because you, like the way you feel dry when you don't have water, it's a similar feeling that you get, that you might, your breast would feel dry and you won't be producing much milk at that time when you have not eaten on time. uh, so it's important that you are eating on time, and not necessarily on time, but eating at least to keep your metabolism on the go, so that you are able to produce the milk in the same manner as how your metabolism is taking place. Meeting your calorie intake is about like at least 300 more calories. It's not that you are taking in too many fats. It's important you take that very nutritious foods that help in development of the milk supply. And C for allergens, dairy, egg, nuts. It's again depending on your gut micro gut health and also the infant's gut health. Many infants are allergic to dairy, egg, and nuts. So when you see the babies having issues with the colic or reflux when you have certain foods, then avoid those foods. That's just by the way of trial and error that you will get to know what kind of foods are suitable for your baby or not. Correcting your gut is very important in understanding your own gut health and the kind of milk you're producing, the milk supply, and how the baby reacts to the milk. Lactation support comes in all stages of your breastfeeding journey until you have established breastfeeding and probably even after that. But in the initial stages where many mothers require the lactation support is the lactation support can be in the form of foods, where you eat certain foods or galactologues, which help you boost the milk supply and help also to maintain your milk supply whenever you need to feed the baby on demand. Again, through your logs, you can understand what are the kind of foods that help you. Some foods are like fennel seeds, fenugreek. It's for different mothers, and different cultures have different kind of food suggestions. So you can also discuss with your support groups or your breastfeeding counselor and understand if you can have those foods for increasing or helping your baby get more milk. Emptying your breast to produce more milk is the golden rule for producing more milk. The more your baby sucks, the more your baby is emptying your breast, the more the milk you make. That signals the brain, whenever your baby is sucking, it signals the brain to produce more milk. And according to the growth spurt of the baby, that again sends the signals automatically to the brain to produce that amount of milk as the baby is growing. So never ever feel discouraged if your baby is sucking continuously. That's a very good sign because it is helping you produce more milk for the baby according to their age. Lactation specialists and breastfeeding counselors come into play in whatever situation you are facing issue. You can get in touch with them through WhatsApp, through physical visits, through phone calls. At any point of time in your breastfeeding journey, you're having a problem, we are always there for you and help you establish a successful and an earlier breastfeeding journey with your baby and a healthy breastfeeding journey with your baby. Just mentioning, apart from all of these, we also as mothers have a lot of housework and older children to manage. So it's important that we try to arrange these kind of managements before we deliver our child so that we are not overwhelmed with these issues post delivery, because we are in that postpartum period, that vulnerable state of mind also, that we are not able to make the right decision at that point. We just need support at that point. And also bonding with the baby is very important in the first initial months of life. So taking for a family support where your husband is the first step to family support, your mom, your relatives, your extended relatives, your friends, your community comes for help. Take help from the community and let them know that you have given birth and you might require some kind of help. Order meals if you cannot cook, or if you cannot have a maid, then you can order meals from out for some few weeks, so that before you get into that establishing the breastfeeding supply, you do need some help. That is the main priority, where you bond with the baby and you are able to have the meal on time and have that rest and have that sleep, so that you can establish the pattern of breastfeeding with your baby. And once that is set, you can go back to your general household routines. And it's also important, like every postpartum mother, for the first 40 days, it's complete rest for you and you are able to take care of your health and your baby at that point. Hiring external help helps if they are coming and helping you with your baby's massage, the food being cooked and the house be getting cleaned on time. So it helps a lot to manage your work at a large extent. Managing your stress levels is very difficult during the initial first few weeks of motherhood, especially for new moms. So getting this kind of support from family, community, or also managing your time by ordering meals, getting extra help, does help you manage stress levels. And also having that self-care and that sleep that is required would would help a lot in maintaining your milk supply, because the milk supply gets impacted when you have stress. It varies. So to stabilize it, you need to stabilize your stress levels and everything around you in the environment and your internal self. It's important that you help in establishing your breast milk supply. Now, when to use a breast pump? There are certain situations where mothers are required to use breast pump in cases of, again, sometimes in cases of having uh, mastitis, or if they're going back to work, if they need to pump more to improve, if they don't have, if in reality that they have a low milk supply, then they could, to maintain the milk supply, they could pump. So when they're discussing their issue with the breastfeeding counselor or the lactation consultant, they are best people to advise them on when exactly they should be using the breast pump, what kind of breast pump to use. The first initial step always is through expression, because direct expression of milk into the baby's mouth is much better for the baby's gut also, because the milk is not interacting with any other outside sources, and so it's directly from the mom's breast to the baby's mouth. So that is the best way the mom could express, and expressing is better than pumping. In first, in the effort, in terms of effort and cost, also in terms of what the breast milk is interacting with, because the microbes are present everywhere. The microbes also interact of the mom, the microbes of the mom interact with the microbes of the baby, and that also helps in the baby's improvement of the gut. Expression is best. Compression is when you need to compress your breast when the baby is not able to suck well, and help the baby to latch on well to get in milk effectively. Pumping comes when you need to go back to work, or when you need to, when your milk supply has been impacted to a large extent, or to manage between different feedings. Pumping comes at that point of time. Mixed feeding is where you are already formula feeding and also breastfeeding, but you want to go back to breastfeeding. And to help you go back to exclusive breastfeeding, you keep pumping in because you don't lose your milk supply. And every mom has faced an issue of low milk supply when she has substituted with formula, which is not healthy. So it's important that with the formula, if she has started to wean off the formula, she needs to start pumping to maintain her milk supply and make it a practice of exclusive breastfeeding for the baby, which is anyway long term, it's better for the mom and baby, and getting weaned off from the formula is a higher priority. Again, when mothers who need to go back to work require pumping to be done, some mothers do exclusive pumping, some mothers do part pumping, and then they go back to breastfeeding when they are home. It's important that any working mother needs to assess her situation and as much as possible try to breastfeed her baby even during when she's working, unless it is a very difficult situation where she has to exclusively pump to give the baby. Uh, Choosing a pump is very important. There are single electric pumps, there are double electric pumps. It depends on the kind of uh, pumping schedule for you and the baby, how you need to provide according to the need of the baby and according to your schedule. Again, discussing with the breastfeeding counselor or the lactation consultant will help you in determining according to your situation what kind of pump you need. Choosing a caregiver for your baby at that point when you're going back to work is important, so that they are taking care as you have given them the directions to, so that they do not uh, create any negative impact on the baby's feeding. Now, expressing your milk is first by hand, which is the most effective and the most safe and the most hygienic. But if there are alternative feeding devices that you need to use, can be through pumping, through breast pumps, bottles. But noting down that paste feeding is important, which I would not recommend personally, because every baby who's introduced bottles has a possibility of nipple confusion. So bottles should be the last resort where everything is tried and nothing is working out. Maybe that, and that could be the paste feeding, which also the lactation counselor or the breastfeeding counselor can help you out with. But that should be the last resort, the bottles, because every mom resorts to bottles in the first place, thinking that it would make things easier for her, but it can alter and make things more difficult for her instead, because the baby will end up having a nipple confusion. It's better to actually feed the baby through spoon or syringe or through a cup, because the baby will not have any confusion whatsoever during that time. She can express by her hand and feed the baby through spoon, syringe, or cup. Breastfeeding supplementer is a device where the supplementer, the tube is attached to a bottle or a container, and that supplementer is attached to the breast, where if the mother is having milk supply issues, she can use this breastfeeding supplementer, where the baby is getting the milk from the expressed milk in the container, but the baby, when the baby is sucking through the breast, the milk is coming through the tube. So it's in two in one. The baby is getting the milk at that point of time the baby needs, and also it's indicating for a sucking pattern for the breast, to produce more milk. Evening cry patterns is again cluster feeding, where the baby feeds a lot because of comfort or growth spurt, or even if there is a letdown reflex that slows down, usually for the mothers during the evening times. That time is a time where the baby is also exhausted, and the mother's even energy levels go down. The stress levels are usually higher during the evenings because the sleep has not been there. So because of the late letdown reflex, the babies tend to get more fussier during the evenings, and they tend to suck more, or they have a cluster feeding pattern at that point of time. But you should not worry about that. Just make sure that you are well rested at that time, having a good calorie food, relaxing, and then allow your letdown reflex to flow naturally, and your baby will be eased naturally. But it does take some effort and some few weeks till your breastfeeding supply is established, so that you learn how to deal with those reflexes at that point in time. Now, last but not the least, I would like to mention the breastfeeding hack. Making a baby log is very important for all of the new moms, even the new moms for the second time, third time, fourth time, because every baby is different, every baby's patterns are different. So having that baby log from day one will help you understand your own milk supply, your stress, your environmental factors, and your nutrition factors. Analyze them and then see how your baby is reacting to that, so that you know what you need to change later, and also use that information to discuss with the breastfeeding counselor or the lactation consultant, and get those measures accordingly to the stage where you're facing the issue in. So a baby log has been a lifesaver for me personally, where I have used it and also discussed with my breastfeeding counselor. Even though I'm a counselor, it is possible that you face certain challenges that you cannot handle it at that point of time, and something is new to you. And there are so many things that as a new mom you will see, even with the data you read, when you experience it, it's totally different. And that keeping that log will help you manage your supply in a way where you can establish your supply within a month, or within a maximum of 2 months of your breastfeeding journey, inshallah. Thank you so much, all of you, and I hope that my talk has been beneficial um, and informative, inshallah. Thank you so much, Amal and Sharjah Breastfeeding Friends, for having me as a continued education. Jazakumullahu khairan. Thank
Thank
you.
you, Sister Aisha. Thank you. Inshallah, see you next lecture. Thank you, everybody. I hope follow the evaluation in chat. Thank you.